I'm Michelle Archuleta, and I'm an enrolled member of the Lone Pine Paiute Shoshone tribe from the Owens Valley in California. My formal position with the Indian Health Service is the National Community Health Representative Consultant and Community Health Team Lead under the Division of Clinical and Community Services. Today, I have the pleasure to welcome you to today's virtual town hall, brought to you through a cooperative agreement between the Indian Health Service and Johns Hopkins Center for American Indian Health. Today's presentation is the second in a series for community-based health workers serving on the front line in Native communities during this time of the new coronavirus. Today's town hall has two main presenters, Dr. Laura Hammett and Dr. Jill Moses. Dr. Hammett is the Director of Infectious Disease Programs at the Center for American Indian Health and an Associate Professor at the Johns Hopkins Bloomberg School of Public Health. Dr. Moses is a board-certified pediatrician and the Director of Public Health with the Chinle Service Unit with the Navajo Area Indian Health Service. During today's presentation, we also have two invited special guest presenters, Rear Admiral Kelly Taylor and Miranda Carmen. Rear Admiral Kelly Taylor is the Director of the Division of Environmental Health Services for Indian Health Service. She is also the Chief Environmental Health Officer for the U.S. Public Health Service. She began her career as a Service Unit Sanitarian in Pine Ridge, South Dakota, and has spent her career with the Indian Health Service. Miranda Carmen serves as the Mental Health Lead of the Division of Behavioral Health with the National Indian Health Service. Alberta Vicente, the National Health Promotion Disease Prevention Consultant, Ms. Tina Tall, the Public Health Nursing Consultant, along with myself, will serve as part of a panel team. Just a few housekeeping items to go over. We encourage lots of questions and ask that you use the Q&A box. We will make every effort to answer your questions up to the hour. Hopefully, we won't go over. And with that, I would like to say thank you to our participants on the call, our presenters, and our special guests, the panel team, and the wonderful, wonderful, talented public health professionals who really make the magic happen behind this town hall. We welcome you and thank you. Back to you.
Thanks so much, Michelle, and thanks everybody for joining. It's great to be with people again today and have the opportunity to talk through some of the new issues that have come out with COVID-19 and really highlight today the community-based response activities around protecting community health workers, and as you heard from Michelle, hearing from the Division of Environmental Health Services and hearing about mental health and how we can take care of ourselves and others in COVID-19 times, and then also to share resources that are available. We're going to start by just doing an update on the current state of affairs with COVID-19 disease. You can see this updated case count from this morning with over 3 million cases reported to date. On the next slide, you can see the breakdown for cases in Indian country. These data are available from the Indian Health Service website by IHS area. And then I've highlighted, as you can see from that table on the left, we have COVID-19 cases in all parts of Indian country. But the largest number of cases is occurring on Navajo Nation, and the images on the right are the data most recently from Navajo Nation's website, with 1,873 cases having been identified in all areas of Navajo Nation. We'll go ahead and go to the next slide. And I want to, everybody who has joined us last week heard from Dr. Jill Moses at the Chinle Service Unit. And I think one of the things that those slides don't tell you and that we don't emphasize enough is the number of people who have recovered from COVID-19 disease. There are lots of cases. There are lots of people who do end up having to go to the hospital. There are a small number of people who unfortunately don't survive this illness, but there are many, many, many more people who do survive this illness that Dr. Moses is going to share a story now.
Thank you, Laura. So I wanted to share a story that was told to me by Rydell Curley, who's one of our public health nursing health technicians. So in Chinle, we have a number of health technicians that work with public health nursing, sort of in the role of like a community health worker. And I'm going to tell a story. I'm going to call her Jane. And it was a confirmed case in our service unit. So Jane is a middle-aged woman that works as a cook in a school in a community that was hit hard and early in the COVID-19 outbreak on Navajo Nation. And although the school closed in mid-March, the kitchen staff continued to work to prepare food for families to pick up. And Jane was working side by side in the kitchen with a coworker who had a slight cough. One day Jane was working with her. The next day she heard that her coworker had gotten very sick very quickly and died at home before an ambulance could reach her. That then prompted an investigation by the part of public health nursing to find close contacts. And Jane was identified as a close contact, and public health nursing started to call her every 1 or 2 days to check on how she was doing. Over the course of the next week, she developed a slight cough and fever and some shortness of breath. She was referred for testing, which she received, and a couple days later was notified of her positive test result. Public health nursing continued to call her daily for wellness checks, and as her symptoms progressed, she was admitted to the hospital a few days after her diagnosis, but was only there for 4 days and then discharged home, still under isolation to recover. Meanwhile, her husband and 3 other family members that lived with her developed mild symptoms. At that point, testing was still somewhat limited, so none of them ever were tested, but they were still followed as probable cases since they, lived in the same household with a confirmed case. So Jane, through her recovery, she experienced a lot of anxiety and sadness because of the sudden loss of her friend and coworker. And so when the public health nurse, when the health tech would call, she would ask, like every day, she would say, "Am I going to die?" So she, this like anxiety and stress like made really, was a very challenging part of her recovery. But the health technician arranged for counseling visits for Jane by phone, and also a phone visit with one of our staff native healers. And Jane found those sessions very helpful in dealing with the uncertainty she faced during the recovery process. So public health nursing followed Jane and her family for a month, talking to them almost every day. And when the family was all fully recovered and the time came to release them both from home isolation and to end the daily calls, like Jane and the health technician have mixed feelings about it. Both were they were happy to know that the family had all survived the experience safely and the husband could go back to work because they were running out of money, but they were also kind of sad to have the daily calls end. So I want to thank Rydell Curley again for sharing that story. And I think it really illustrates a lot of of what we hope will happen with case management of people with COVID-19. It actually, this involved a public health nursing across 2 different service units and communication back and forth, and healthcare across 2 different service units. And so I feel like that it just shows a lot of what really can go right with supporting families. Thank you.
And I think, Dr. Moses, do you want to take us through these prevent techniques on? Yeah.
Sorry, we're figuring this out as we go. Okay, so community health workers with the COVID-19 response really could be our they've been our epidemic response corps of the past, but not nearly on the scale that we're dealing with now, and it certainly will be in the future. So the there's three, main areas that that community health workers can play a role to prevent and detect and respond to the epidemic. So to prevent, one of our biggest weapons for prevention, since there's no treatment or vaccine, is to have people stay home if they're sick. And that means, people out in the community, but also any staff. That's really important. Even if they aren't sure if they're sick or not, it's always better to be safe and stay home, even if it's a mild illness. Community health workers can also help with organizing and carrying out social media campaigns and community education to promote social distancing and hygiene, hand washing. They can encourage strategies in their communities and online to promote mental and physical health and resilience during this difficult time. They can assist with and are assisting with delivering food and medication and other basic essentials to elderly and vulnerable residents. And they can help with making masks, homemade masks, and to donate them to the stockpile or the stock of personal protective equipment at local hospitals for employees that are not involved in direct care. And for detection, it's important for them to learn the signs and symptoms of COVID-19, and then they can help staff hotlines run by hospitals or public health departments to answer questions from the public, and can refer possible COVID-19s to their nearest testing center and organize transportation. And then lastly, with responding, community health workers can be a huge assistance to public health nursing to call people. The volume of calls that need to be made is really tremendous as as we get into this epidemic. So to help with calling people with COVID-19 who are isolated at home and help monitor them for worsening symptoms. They can also, like in the story I told, provide moral support. They can organize food deliveries for people with COVID-19 at home, or those that are quarantined, that have been exposed. They can support rapid referral of people who require hospitalization, and can consult with nurses or providers at their health center as needed. We know that people can sometimes, about a week into illness, can sometimes be feeling better by some markers, like no more fever, or their taste and smell returns, but then still develop trouble breathing. And so it's really important to ask those questions about any chest tightness or shortness of breath or trouble breathing, especially with exertion. And if that seems to be getting worse, it's really critical to encourage people, even if they otherwise feel well, to go in for evaluation. We found that that has really made a difference for quite a few of our patients. With public health officers, they can work to support contact tracing, symptom reporting, and monitoring of contacts, and can help assure access to testing and treatment for people who develop signs and symptoms, and help hospitals and nonprofits raise funds. Those are all ways that community health workers have been involved in the response and can be. Laura, my turn is over to you now.
Thanks, Dr. Moses. And I hope everyone on the call that you all see yourselves in these words: prevent, detect, respond. Community-facing workers are a critical part of the pandemic response. And we want to, on the next couple slides, to just make sure people know what they can do to help keep themselves safe as they're going out into the community and doing work. As everyone knows, there's now general guidance to wear a mask when out in public places. This is more about protecting other people around you necessarily than it is about protecting yourself. Because we know when I wear a mask, I'm protecting you. When you're wearing a mask, you're protecting me. Those masks are really meant to be limiting the spread of infectious droplets from people who may be asymptomatically infected. We know that 25 to 50% of people can actually have COVID infection, but will remain without symptoms, or may be able to have the infection and potentially be spreading it before they develop symptoms. So wearing a mask is a really important way to help reduce the spread. And using a face mask, just a quick reminder for everybody on how to do that. Make sure to wash hands using the 20-second rule before putting the face mask on. Secure it over the mouth and nose, and try to get as tight a seal as you can without any gaps. And then avoid touching the front of the mask. If you do, wash your hands for at least 20 seconds. When you remove the mask, if it's a disposable mask, then obviously throw it into the garbage. If it's a washable mask, then put it in the laundry, and then wash your hands again after removing the mask. The next slide shows personal protective equipment for people who are involved in direct patient care with COVID-infected individuals. So for people who are doing this, hopefully everyone has gone through proper training on how to don and doff or put on and take off personal protective equipment. But for interacting directly with COVID-infected individuals, the preferred personal protective equipment includes a face shield or goggles, some form of eye protection, a mask, a gown, and gloves. The type of mask that can be used includes a regular face mask or an N95 mask, the latter of which is really recommended if you're doing any sort of aerosolizing procedures, suction, or anything like that. One thing that we've heard from a lot of people is how intimidating it can be to have what looks like a biohazard team show up at their house or somebody that's sort of decked out like this. And so if possible, when you're out in the community meeting with people who, if you're having to do a wellness check or home visit to drop something off for a family that's affected by COVID, and it's something where you actually need to go into the home and interact with that individual to do a health check, then try to greet patients from a distance. So when you're at your car, before you put on all of your personal protective equipment, just so that they can see you and that you're a regular person and that they know what you look like and can get a little bit more comfortable with you before you put on this isolation or personal protective equipment. Some people have even taken to putting pictures of themselves on the front of their isolation gown so that you can see sort of, this is what I look like, this is me. You're not just talking to a face shield and a gown, you're talking to a person, and it's me. And then we've also developed, as part of this partnership with Indian Health Service, tips for healthcare workers when they're coming home, going to and coming home from work. And so I don't want to go through all of the details here. These are available online, but to make sure as much as possible to have safety in mind as you're going to work, bringing separate shoes and possibly separate change of clothes in the bag, and having disinfecting wipes handy. Before you leave work, making sure to wash hands, arms, and face with soap, if possible, showering at work and wiping all of your items that have been in the workplace down, and ideally not bringing them back into your home with you, but just keeping them in a bag that then doesn't risk transmitting anything to your family members. And then just before you enter your house, doing another wipe down, changing your into home shoes as opposed to work shoes. And then if you've been involved in COVID, care at the hospital, making sure that you're laundering your clothes and disinfecting any other surfaces. We wanted to also really address the other community-based health programs that have been very active in this COVID-19 response. The Division of Environmental Health Services, which includes the areas of community injury prevention and institutional environmental health. And this group monitors and investigates disease and injury, identifies environmental hazards in the community and in healthcare facilities, and provides training and technical assistance to communities. And we'll also hear about the mental health program, which is an integral part of the IHS healthcare system and offers a wide range of services, including promotion of social and health goals to enhance emotional security of individuals and groups. And as you heard from Dr. Moses earlier, really providing some critical mental and emotional support during this pandemic. So I'm going to turn it over now to Rear Admiral Kelly for a discussion of the Division of Environmental Health Services work.
All right, thank you. I appreciate the invitation to speak about the Division of Environmental Health Services today. During this presentation, I would go back to the, don't switch slides yet, I'll go back. During this presentation, I'd like to explain who we are, what we normally do, and how we've adapted to working in tribal communities during this all hands on deck response. I first want to say that we are still here. Our public health approach to ensuring people are protected from things in the environment makes us completely suited to continue our activities and services in the communities, but just focus those activities and services on COVID-19. Now, next slide. Our environmental health staff are highly trained professionals who provide a broad scope of services that protect people from harmful effects of things in their environments. We've identified 5 focus areas: children's environment, safe drinking water, food safety, vector-borne and communicable diseases, and healthy homes. This is our mission statement, and you can see it's similar to most other IHS mission statements, and we want to enhance the health and quality of life of populations we serve to the highest level. One way we do this, though, is through shared decision-making. In an effort to provide the most comprehensive services possible, our program utilizes the public health approach. Next slide. The majority, this is what we do normally. We are community-based, and the majority of our 130 or so federal staff are stationed in tribal communities rather than in area or headquarters offices. We partner with about the same number of tribal environmental health staff to address environmental health issues. You can find us providing hands-on environmental health services in tribal facilities that include schools, daycares, Head Starts, elder care facilities, detention centers, restaurants, individual homes, and more. Specifically, we engage in disease and injury surveillance activities. We conduct inspections. We do a lot of inspections, investigate outbreaks, respond to medical referrals, provide environmental health related training, and we develop interventions in response to environmental health issues. All of these services ideally include some element of community partnerships. So the picture on the left here shows Rebecca Abangan, an environmental health specialist who's conducting the food safety survey at a tribal convenience store. The middle picture is Lieutenant Patty Rona, who's doing she's assisting in a child safety seat clinic. And the photo on the right is Captain Mike Box, who's testing welding exhaust ventilation at the Alaska Native Medical Center. Next slide. So now I'm going to switch to what we're doing related to COVID-19 response. It's how we've shifted our activities to focus on this now. We've tried to categorize those roles into these 3 areas: community-based, institutional environmental health, and our participation on incident command systems. And I'm going to talk a little bit more about these specific roles in later slides. But we've also responded not just locally, but outside of IHS. 12 commission officers, EHOs, have been deployed as safety officers and team leaders at drive-through test sites and repatriation effort at Lackland Air Force Base, as a food safety officer at the Air Force Base, and also screening passengers at quarantine stations at airports. And those deployments lasted anywhere from 11 to 27 days. And this is just a sign for the COVID drive-through testing site, and this is at White Earth in Minnesota. Next slide. So for our community-based efforts, some of the specific activities we've done are collaborating with tribal environmental health offices to assist tribal health organizations and communities developing their local response plans and education materials. We've conducted outreach to homeowners. We ensure that water and sewer organizations are able to deliver reliable services and identify those water and sewer disconnections for non-payment, possibly, of bills, to see if reconnection might be possible to kind of address the potential COVID-19 prevention control measures. We also conduct contact tracing to assist some of the public health nurses. We target community-based public health messages to tribal leaders, health directors, child care programs, elder nutrition centers, and more. We still do a lot of our food safety activities, and we help coordinate submission of laboratory samples for COVID-19 testing. So in this picture on the left, that's Lieutenant Commander Sean Blackshear, who ensured that hand washing stations were available, and he also provided training at Yakima Clinic in Washington. And on the right, that's Lieutenant Commander Molly Madsen, who deployed as a safety officer at a drive-through test site in New Jersey. And she's wearing her N95 respirator and holding a hand sanitizer that was made at a distillery. Next slide. This is the activities related to institutional environmental health. We provide cleaning, disinfection training for housekeeping staff and village and tribal health clinics, conduct safety and environmental infection control assessments and technical assistance at IHS offices and tribal health clinics, homeless shelters, child care, elder care, senior centers, correction facilities, and drive-through test sites. We develop respiratory protection programs and conduct fit testing for those who wear PPE. And we're involved in a lot of activities related to personal protection equipment, from documenting the needs to securing, managing, distributing supplies, and then training people on how to don and doff and how to use it correctly. So we conduct ventilation assessments in order to verify adequate air exchange in isolation rooms and develop safety guidelines and policies for area staff that are required to work in the field operations or who return to their offices. And we also have staff who have assisted in conducting site surveys for potential alternate patient care sites. And on the left, we got a picture here of COVID drive-through testing site in White Earth. And on the right, that's Rebecca again, who's conducting, this time she's conducting a respirator fit test on a law enforcement official. Next slide. So related to incident command systems, we're very involved at all levels of ICS, whether it's national, state, area, or service unit. And in some areas, staff, environmental health staff are the incident commanders, others are the logistics and planning section chiefs. One has even served as a public information officer, but most of the time our staff are tasked with being the safety officers on the incident command systems. In half the areas, staff, environmental health staff are the IHS area IMPOCs, or emergency management points of contact. In one area, staff serve on the State Operations Center to support the Tribal Affairs section, and they contact tribes about their needs. In that same area, staff coordinated a webinar to share information from FEMA and the State Office of Emergency Services about funding opportunities for tribes. And we've also had an EHO detailed to FEMA's National Response Coordination Center to help manage the IHS and tribal equipment requests from the Strategic National Stockpile. And these pictures are the California Emergency Operations Center, and you can see on the right the Tribal Liaison Desk, which is where our staff are helping out. Next slide. So one of the last things I wanted to say is we are still here. It may not be business as usual. This is a screenshot of District Environmental Health Officer Commander Vince Garcia, who's conducting a virtual team meeting. We've had to make some changes as to how we do our work, but we're still doing the work we've always done, plus more. We continue to work in the communities, doing what we've always done, but now we're focused on the environmental threat that is coronavirus. And although it's a serious threat to the health and security of our nation, it's a somber reminder that a focus on public health is what is needed every day. If you don't know who your environmental health officer or sanitarian is, there's a list of area office contacts on our website, and you can get a hold of them. Our website is ihs.gov/DEHS. So the last thing I want to say, wash your hands, don't touch your face, practice physical distancing, and follow the CDC guidelines. So thank you very much.
Thanks so much for Admiral Caroli. I'm going to turn it over to Miranda Carmen now, who's the mental health lead for the mental health program.
Hi, good afternoon, everyone. This is Miranda Carmen. I serve as the mental health lead in the Division of Behavioral Health at IHS headquarters. I'm a member of the Muskogee Creek Nation of Oklahoma and also a licensed clinical social worker. And I am going to be talking today about how important it is for all of us to take care of our mental health during COVID-19. Next slide. And so as we all know, our mental health is connected not only to our emotional health, but also to our physical and spiritual health, and these are all related. Unfortunately, we may have some reactions to some of the things that are happening due to COVID-19, but all of these are definitely normal symptoms that we may be experiencing. So it's definitely okay for us to feel stressed as we learn of things, or to feel sad. Our lives have changed and shifted pretty dramatically with not only work but our home life, and so we are as parents or even as caregivers juggling different things, and so those things may be overwhelming. Some of the symptoms of stress and anxiety that we could feel are headaches and breathing rapidly, and even a tightening of the chest. Some of these could feel like COVID-19 symptoms, so it's definitely important to remember the guidelines of the COVID-19 symptoms and know when we should be seeking medical attention. It's very important for all of us to pay attention to our own thoughts and feelings. One of the things that we've implemented in our weekly staff meetings is doing just a check-in to see how everyone is doing. And then once we kind of tell how we're doing, being sure and letting everyone know that we have someone to contact if something were to come up, that we have a person in mind that we would reach out to. So it's very important to stay connected, not only to our colleagues and partners as we work, but also to our family and friends, and making sure we're reaching out to those that we know may not have someone during these times to talk to. So FaceTime, I'm sure, is something that a lot of us are using right now. Next slide. So I think also things to keep in mind is what is definitely in our control and what is not. So we know that we can definitely wash our hands, and we can remind others to. We can use our face masks, but I think limiting news and social media and making sure that we're not spending too much time on that is definitely healthy. Finding things that give you a sense of safety is also important. So whether that is staying at home, or maybe it's, you know, taking a walk, or just things that make you feel safe, finding those things that that work for you. Next slide. And so as we are thinking about taking care of our bodies and making sure that we make time for ourselves, definitely incorporating deep breathing and stretching. If you practice mindfulness or are familiar with mindfulness exercises, that is definitely a way to kind of wind down. There are some helpful apps. I know that Headspace, there's an app called Headspace that has lots of self-care and well-being pieces to it that is free right now for healthcare workers if you have an MPI number. So definitely recommend, if you haven't had a chance to check that out. Another way to check in and just see how you're doing is to do some grounding exercises. So checking in with your five senses, taste, sight, touch, smell, and hearing. And that's an easy way just to do a self-check-in. Again, as I mentioned, connecting with others. We all are having to practice social distancing. So right now, phone calls, texting, chatting by video whenever we can, just making sure that we're all staying connected and finding those things that we really do enjoy outside of social gatherings. So just for instance, gardening, journaling, reading, all of those things are important. And then I think lastly, making sure that we practice gratitude and being grateful for what we do have. So making a list of the things that you are grateful for and thankful for, and recognizing that this won't last forever, but this is a very temporary situation, and we will all get through this together. So I want to thank you for your time and look forward to any questions that you might have. Thank you. Oh, we have one last slide. Okay, tips for, yeah, one last slide. I know we were going to just summarize this one because of time, but just some tips for parents and caretakers to know that we are all having to juggle lots of different pieces. So not to allow yourself to feel overwhelmed because of those things that we're playing teacher potentially along with parenting and having to work. And then some strategies on how you can talk to your child about COVID, just making sure that we're having honest conversations with them and providing them with as many facts as we can. Thank you.
Thank you, Miranda. I think really important information for everyone to hear. Want to just remind people of the different social messaging guidance that's out there and available to share and help support messages around social distancing, around staying at home, and recognizing the things that each of us can be doing to help slow the spread in our communities. On the next slide, we have a list of resources. There's just really seemingly an infinite amount of information available on COVID on the web. And so this is a list of reputable resources where you can get reliable and accurate information about coronavirus, about what is happening in Indian country in response to coronavirus, and places that you can use not only for yourself, but for people that you may be supporting in the community. And the last slide just reminds you of the contact information for the community-based health programs that were part of this session and of our last session there. So please do reach out for anything in terms of needs or support. And we are going to switch now to be able to have some time for Q&A. If you have questions, please feel free to use the Q&A box that's at the bottom of your screen, and we'll take some questions through that Q&A interface there. So a question has come in, and I'm going to ask Michelle if you're able to address this one.
Sure, I don't see the question.
Oh, I'm sorry. If you click on the Q&A button at the bottom, it will should open up the Q&A panel. But there's a question about whether CHWs are getting hazard pay.
I don't know that for sure, so I apologize for that, of not having that specific answer. I would have to research to get back, and I will put it in the FAQs that we're going to disseminate at the probably at the end of the week, and that question will get answered.
Thank you. Rear Admiral Kelly, there's a question about a site that's looking for a safety officer and how should they go about requesting one?
Well, I would say that you probably would want to contact your environmental health or sanitarian where you are and kind of start from there. I'm not sure where it is, if it's at a healthcare facility or somewhere else, but that would probably be your best bet, to start with your local environmental health or sanitarian. And I can always help if that doesn't work.
Thank you. There's a question about differences in outcomes for COVID-19 in tribal populations compared to others. As everybody is probably aware, we're just learning day by day, and new information is becoming available day by day. But the initial analyses that have been done do suggest, similar to what we've seen in past respiratory disease pandemics, that there is more severe disease and more severe outcomes in Native American populations. A lot of that, we think, is driven by social determinants of health as well as underlying conditions. There is a higher prevalence of underlying conditions that contribute to more severe disease and more severe outcomes. Those things include things like heart disease, like hypertension, lung disease, diabetes, and obesity. There's another question about the particular issues facing Navajo Nation and the response that IHS and others, such as the medical team from UCSF that went to Navajo Nation. Thank you, Sheila, for your question. And I think as you saw on this slide at the start of this presentation, there have been over 1,800 cases tested positive here on Navajo Nation, and many thousands more who've tested negative. But a lot of people have been, had to go through isolation. A lot of other people who have had to be placed in quarantine. And I think Navajo Nation's really done a tremendous job trying to mobilize resources to be able to ensure that people who do end up having to go into isolation or in quarantine have their essential needs met so that they are not having to go out into the community. Certainly one of the challenges that we do see in areas that have water scarcity, and there are some communities on Navajo Nation that lack running water, just as there are, a number of Alaska Native villages in Alaska that don't have easy access to running water. That can make it hard to comply with our guidelines, which are for frequent hand washing. And so trying to work with grassroots organizations as well as Navajo Nation to increase access to water. You heard from Rear Admiral Kelly about the efforts that IHS is undertaking. So a lot of people coming together to try and address that, particularly for water scarce areas. I think another challenge that has been faced, as you said, is that we have limited capacity in terms of healthcare systems. And so one of the things that Navajo Nation has done has been to facilitate medical volunteers being able to come to the area. So there was a deployment of medical volunteers from UCSF that arrived. I'm losing track of time, as probably is happening to many of us out here, but who recently arrived and have really been greatly appreciated, providing reinforcements for IHS and tribally operated healthcare facilities. There's a question here about groceries, and I don't think, thank you for looking for that slide. I don't think we have the slide that's up right now about groceries. We are developing guidance around that. I think in general, when you go to the grocery store, this virus is transmitted through respiratory droplets. So the virus is not going to, jump off of surfaces and into your lungs, but virus can land on surfaces. And so, and we can touch those surfaces with our hands and then potentially inoculate ourselves with the virus. And so it's really thinking about very good hand washing anytime you come back to your house from anywhere that you've been, whether it's the having to go to the post office or having to go to the grocery store, or wherever you've been, make sure you do frequent and good hand washing, ideally when you're actually out and about, and then certainly when you get back home again. For groceries themselves, there's no evidence to suggest that COVID-19 has been transmitted by food. That's not been found to be a sort of a mechanism of transmission. But we do know, for example, that it can stay on paper bags or cardboard boxes. So you do want to, if you're bringing those into the house, decontaminate the countertop after you've placed your groceries down and put them away. I think good general practice to wash fruits and vegetables before you're eating them, in case any sort of infectious pathogen may be on those. So that's good general practice. And I would say that's general guidance for when we're in the grocery store, as well as the social distancing measures, not going, during peak hours. A lot of grocery stores have implemented systems where you can only go one way down an aisle, so that they're minimizing sort of people crossing paths in close proximity to one another. So trying to go when there are not as many people available, maintain those 6-foot distances, do good hand washing. And if you're worried that you've been sort of leaning up against a counter or brushing up against a lot of surfaces, then you can certainly, change out your top or whatever when you get home. Okay. Questions about training on infection control. And Rear Admiral Kelly, I don't know if you can see this question from Braden Hickey around requests from Tribal Incident Command to provide infection control and environmental services.
I saw that question, and I'm trying to think of the best place to refer Braden to. I know our institutional environmental health officers and the Environmental Health Support Center have provided training in the past on infection control. I just don't know if they have a webinar available or if they recorded those trainings. I would start with Braden, talking with the institutional environmental health officer there in the area. And then I will actually get with the institutional environmental health program manager in headquarters and see if there's something that they know of that's available, because I'm sure you won't be the first one to ask that, the only one to ask that question.
Okay, thank you. There's a question about, is IHS endorsing a standards of practice in working with tribes? And I'm not sure if I understand exactly what that question is getting at. So if the person who wrote that question wants to submit a follow-up, then we can try and help answer that. Another question here about numbers in Rapid City. And whether there are any cases in Pine Ridge. And I don't know the answer. I don't know if any of the other panelists want to chime in if specifically there have been cases identified in Pine Ridge. I think we all know that we're really just detecting probably the tip of the iceberg. We don't have sufficient number of tests available to test everybody who we may suspect of COVID. It's in some areas we're really prioritizing those limited tests for being used in hospitalized patients or in other higher risk settings. So I think that the sort of lack of testing capacity does hinder our ability to have a bigger picture understanding of the true prevalence of infection. But I do think that, locally people are looking at hospitalization data and can see whether or not there have been sort of spikes in respiratory hospitalizations or not. As we know, the majority of people who have COVID-19 illness will either be asymptomatic or will have mild infections and are able to recover safely at home. But we do want to be, definitely keeping a close eye out on making sure that we're monitoring for that more severe disease and making sure that people can get the care that they need. There's a question about the vaccine trial that's going on at Oxford, and there is a possible vaccine that's moving fairly quickly through clinical development. For those of you who are familiar with the world of vaccines usually take 5+ years to sort of put them through all of the different phases of a clinical trial. So that would be looking at safety, looking at signals of immunogenicity or immune response, then looking at efficacy and large numbers of people. And so we're obviously trying to work on an accelerated timeline here, and there is certainly, I think there is certainly promising work that's coming out of the team in Oxford, but there is still important work that remains to be done in terms of establishing whether or not this is safe and is efficacious. Hopefully, they don't hit too many hurdles, and hopefully we do have a vaccine that's available sooner than what we had projected originally, which was at least 18 months. But I think we'll just have to watch and see. Question from Sheila again, thank you Sheila, about our community health workers trained to conduct contact tracing. I think that very much depends on the local areas that you're working in, but certainly that is a really great use of community health worker skills. The communities really well, where people are likely to have been, you have that rapport, and I think that that's a really good use of community health worker skills, but every area is approaching this a little bit differently. A question about work with border towns when the tribes shut down, but border towns stay open and don't practice any social distancing. And I think particularly on Navajo Nation, but other communities as well, this has been a concern. And certainly we see, oftentimes if you're going to tell people they can't leave home for a long period of time, sometimes that results in a lot of people leaving home at the same time right before that curfew or home shelter in place rule takes effect. And so I think there are ongoing efforts to try to address that concern and try to ensure that people are practicing those social distancing measures, and that we do get that guidance around, send one person to the grocery store. When you do your grocery shopping, come home, wash your hands, do, disinfection of things. So we're trying to reduce the spread in that way. There's a question about tribes from Monty Frank. When tribes have multi-generational home and one member doesn't have an IHS hospital, just a clinic, is there a plan or best practices in that situation? I think, Monty, thank you for that question. It's an important one, and there are a number of considerations around that in terms of one of the things that we're learning is that oftentimes when one member of a household is infected, a number of other people in the household may also be infected and either be asymptomatic at that time or pre-symptomatic, meaning they've been infected but are not yet showing symptoms. But some people in the household are negative, and I think one of the things that we're thinking about now more is can that person who tests negative at that initial, once a case is identified in the household, can that person be sheltered in some other way so that they're not exposed to the other members of the household who are positive, particularly if that's an elderly person or an at-risk person who's there. I know a lot of work and conversation is happening right now about development of both isolation sites as well as alternative care sites, and I think that that's something that hopefully tribal communities across the country I think are discussing with their within their own tribal governances as well as with other jurisdictions. There are a question from Jose Santiago Velez about some of the cultural considerations when dealing with this issue among populations. And I want anybody else who's on the panel to chime in. I know we've got a lot of questions that we're trying to get through in the last couple of minutes here, but please just chime in if you want to add to this. I think across the United States and around the world, really, we have to be aware of cultural considerations, particularly around I think a real emphasis on family togetherness and on caring for our elders, and we have to sort of re-envision what that means to care for our elders at a time when COVID-19 is circulating, and that doesn't necessarily mean handshakes and close physical contact in some cases we have to think about. And it's not necessarily what our traditional values would tell us to do, but helping that person to be separated from other people in the home so that they are sheltered and protected. I think for many cultures, it's, we want to take care of our loved ones and who are sick. And so this idea of having to isolate people who are sick from the rest of the household does not feel natural. And so that is something also that we're having to, try and think about what are the most culturally appropriate ways that we can actually implement some of those things. And I think some of the guidance that IHS has been working on developing really try to take the CDC recommendations and contextualize them for community settings. If anybody else wants to add to that, please do. There's a question about Abbott rapid test kits. My understanding of the test kits is that there is sort of a fixed amount that are being distributed to communities that received the Abbott ID Now instrument. A lot of people are advocating through various different channels to try to increase the amount of test kits that are available, but also working to develop a cohesive strategy so that, if you only do have limited test kits, how they can be best used. Admiral Kelly, I wonder if you could weigh in on the question about the meat packing plant outbreaks and food distribution safety.
Well, I know the issue seems to center more around those people who are in the meat packing plants because they have such close contact with each other. But as far as the safety of the food distribution system, I don't know that I hear, I think you mentioned even that we don't hear about transmission through food, but it's the people who are working in the meatpacking industry because they are so close and they can't practice the physical distancing. And that seems to be the bigger problem. But I do know that we heard that there was, I think, presidential declaration that they not be allowed to close because they're essential to the food system. But that one is, I'm just thinking that it's more a concern of those working in it than those who receive food from it.
Thank you. A couple other questions. I know we're at the top of the hour. I'll try and touch on a few of these. And then what we'll do is plan to collect all of the questions that we don't manage to answer live. And we'll combine them with the questions that came from last week's virtual town hall into a question and answer document that we can circulate and make available, as well as the slides and the recording for this session. So a question from Jacqueline about childcare and Head Start staff wearing masks when returning to school. I think this is right now, that is certainly the guidance, that people when they're out in public spaces, as we mentioned, should be wearing masks, and that would include school teachers at this point. We don't know how long that guidance is going to, remain the same. So I would say to check back, these are evolving, rapidly evolving information that's coming available and policies resulting from that. With regard to the question about children 5 and older, there is a recommendation for children as well, older children, as you say, to be wearing cloth masks when they're out in public, because it is thought that children are asymptomatically infected and can potentially be transmitting infection. Billy, thanks for following up on your earlier question. So I think the question is about engaging tribes around practices for addressing COVID and standards of practices around pandemics. I think implicit in your question is this relationship between tribes and IHS, and I think the most effective models that we've been aware of operate off of a unified command system where both IHS and tribal leadership are engaged in a cohesive response that takes into account the perspectives of both different groups, and also leverages the strengths of both different groups to accomplish the vast amount of work that is really required by a pandemic response. So I think it is important to try to try and have that unified and cohesive incident command model. NIHB, I believe, is posting different pandemic response plans that may have been shared. I think there was, last time I checked on their website, I think I had seen there was just one that had been posted, but there, I think there is an increasing need, and that's something that we at Hopkins are working on in collaboration with others to develop a tribal leaders toolkit, I think, that can help provide guidance around this. I think, given the time, I think we'd better wrap up. I know a lot of people have to switch over to other meetings now. So I just want to thank everybody again for joining us today. I want to thank you for all of the great questions. I see that there are a number of really good questions that unfortunately, I'm sorry, we didn't manage to get to, but thanks so much for everything that each of you is doing. Thank you for being myth busters in your community and speaking the truth about the ways that are important for us to be preventing spread of disease right now. And please, everybody, take care.